My name's Terry, and my girlfriend is called Janine.
Can you tell me how long you've both been deaf?
I was born hearing, and then when I was 6 months old, I had German measles, and then as a result of that became deaf. I was born hearing as well, and then when I was 8 months old, I became profoundly deaf as a result of German measles as well.
Can you tell me what it's like for you when, for example, you go to the shops and try and communicate with people?
I try to talk to people, but I can't communicate with them. It's too difficult. They try to talk to me, I don't understand them, so out comes a piece of paper and a pen and I try and write notes for them. Then they understand what I'm asking for and they show me where these things are and so on and so forth.
Can you give me an example of the difficulties you might have had in the past with accessing Bristol Community Health Services?
Terry received a letter. He asked me to look at the letter because he found it difficult to understand. I then explained to Terry what the letter was about, and it said you need to go to a physio appointment. It didn't say anything about whether or not an interpreter had been booked. So he needed to go over to the office. I wrote a note to say that it was really important that they book an interpreter. So I gave a list of interpreters to the receptionist to ring. And then when the date came, we went back and the interpreter didn't turn up. The receptionist said, I've totally forgotten to book an interpreter for you. So they had to cancel that and postpone it.
How did it make you feel?
I'm not happy. You know, I'm really unhappy about it. He felt really disappointed. We explained that it was really important that an interpreter be there for the physio appointment.
Patients shouldn't have to do this. They shouldn't have to come in a week before to check that an interpreter has been arranged. It should be a given.
Hi, how can I help you?
We should know if a patient has a communication barrier before they've actually even accessed the service. We should have that information on their referral form from the GP to let us know that actually a letter wouldn't be sufficient for this patient, or we would need to enlarge this letter for this patient. It's little bits like that that actually we should have prior to that patient accessing our service.
It's just a waste of time, and this happens quite often. So I asked them to then obviously move the date so that I can have an interpreter available. I then come on that date, and sometimes the interpreter doesn't come again. It varies as to whether an interpreter is there or not.
All health providers and health professionals have a duty to ask about their patients' communication needs. In Terry's case, we didn't do that. We didn't receive the information from the GP, but we also didn't ask Terry about what his communication needs were. So at Bristol Community Health, we're trying to get better at doing that. We're trying to improve our systems, the way that we hold information for our patients, and we're trying to support our staff through various training initiatives so they can best understand that patients have a right to receive information about their healthcare in a way that they can understand.
What would make things better for you? What needs to happen?
So for the likes of hospitals, for GPs, dentists, physios, anything like that, it would be really useful if on their database they had my name. When it came up by default, it would come up with I am deaf and need an interpreter. You know, something like Terry is profoundly deaf, then they would then have access to that and book an interpreter automatically for me. It would save me so much time and energy.
We should be doing things better. As an organisation, we've now introduced our accessible information standard. This is to actually help patients like Terry access their healthcare and actually not have to need to check to see if an interpreter has been arranged. It should just be a given. So this accessible information standard has now come in, and as an organisation, we are actively asking our patients prior to their appointment if they've got any barriers with communication and what we can do as an organisation to help them.
I think it's really important for patients to be able to access their physiotherapy.
With regard to musculoskeletal physio, we need really specific information to gain a diagnosis, to decide, what is wrong with the patient for safety, for consent, so that we're involving the patient in sort of shared decision making, lots of things which are really important for the patient. In Terry's case, I think he would require an interpreter booking, so that would be through our administration staff. With other patients, we've used quieter rooms if patients are distracted by lots of noise. I've accessed leaflets in Braille, and often it's about asking the patient, what is the best way to communicate? How can we help you best?
It's really, really hard for Terry to access his appointment. I've explained many, many times, it's really, really important. We are deaf and we need an interpreter. In the same way that when he's in the waiting room, he can't access somebody calling his name. And we will sometimes wait and wait and wait. And I just think, I can see all these hearing people coming and going, and we're still sitting here waiting. And I just think it's really unfair. So I feel that if they had some sort of system where it stated that Terry was deaf, it would be so much easier, because then they would automatically book an interpreter for us.
We don't always get it right, and even when we make changes, we still may not get it right, we still may make some mistakes. However, as an organisation, we are, with Accessible Information, actively trying to change this and make it better for the patients.